Thanks for the thumbs up. So we are simultaneously live streaming this to Facebook Live for other folks who want to tune in today. But we're glad to see all of you here with us on Zoom. And one of the things that we're doing in our Brown Bag series this time is allowing this to be an opportunity to foster more connection among our community. We know that it's been challenging post-COVID to get together. A lot of the kinds of places where we often see each other have been virtual. And so there's a chance at the end of this conversation to join a breakout room. If that's something you want to do, you don't need to turn your camera on now, but before we sort into breakout rooms, we will ask those who would like to join to have their cameras on, and that will be a signal to us that you would like to join us in the breakout discussion. And it's really just a very informal chance to introduce yourself, your name, your state, your connection to diabetes. If you've had any personal struggles or challenges with accessing the things that you need, which is our discussion today, patient choice, and just anything you found insightful from today's conversation. So again, at the end of the conversation, here in about half an hour, if you would like to join a breakout room, we would ask that you turn on your cameras and we will sort you accordingly, and Jacob will help to make that happen at the end. So thanks for all of you who are joining us, and we will jump in here. So just a quick note for those who are joining DPAC for the first time, DPAC exists to make advocacy accessible and easy for the diabetes community. A lot of times there are bills that are hundreds and hundreds of pages long. There is a lot of legislation moving quickly, sometimes not as quickly as we'd like. And it's hard to keep up as a person who's outside the system to really know what's good, what's not good for patients, and where your voice can be the most impactful. So we send out action alerts when there are opportunities to get involved in a meaningful way in your state process, in the congressional process. We have events like today to help walk through some of the hot topics in our communities. We have state forums. If you want to get more involved in your states, we have Hill Days, where we meet with members of Congress virtually and their staff to talk about key issues. So a lot of really great opportunities. You see our social media there at the bottom if you want to follow us for updates on that, or subscribe to DPAC to be sure that you're getting our newsletter, which we send out regularly with a lot of these events inside. Next, please. So today's topic is patient choice. Sometimes people ask us, what does that mean, patient choice? You see a really good quote here, probably from Stuart, because the only person that should be making medical decisions on behalf of me is me and my care team. So that is really just a way for us to come together to say that the best folks to be making decisions for you, your doctor, entities that we don't want making decisions for you, insurance companies, PBMs, manufacturers, anybody else in the system who's involved in the healthcare process. We know that really what people with diabetes want is to be able to have access to the tools that they need, affordable access to the tools that they need to be able to make the best decisions for themselves and their families. So that is the topic of today. And I will now introduce our panel to have this discussion. And I'm just going to start with an introduction of Stuart Perry, who will then introduce our guest today. So Stuart joins us coming on decades and decades. I don't even know how long, Stuart. I don't want to age you too much, but probably a lifetime of advocacy, as he points to his hair. A lifetime of advocacy is really a stalwart in this community and does so much on a volunteer basis, including serving on leadership for DPAC and our sister organization, DLC. He has a personal connection to diabetes in that he has type 2 and has numerous family connections, including a son with type 1. So he has personal experience, he has professional experience. He served as a past chair of the American Diabetes Association. He's done it all, and he will be our host for today's panel. So Stuart, take it away.
Thank you, Julie. I've done everything but cure diabetes, so yeah, but I'm trying. I am thrilled to be here. And that was a great introduction, Julie. The only person to introduce me better than you is myself. So I'm not going to talk because we've got two very learned experts that I'm thrilled to have the opportunity to be on this dais with. Marissa and Jasmine, I'm sorry, that's Dr. Jasmine, are two of my favorite people, as they well know. If you all can can you all unmute yourself, or has Jacob got you muted? Okay, there we go. Jasmine, you were making me dizzy a minute ago walking around the room with your computer, by the way. I'm an old man, don't do that to me. I know you just got back from picking up your kids. Congratulations. Thank you for taking time to be with us. Would you do me a favor and introduce yourselves? Jasmine, we'll start with you.
Sure. I am Jasmine Gonzalvo. I am in Indianapolis, Indiana, and it's rainy here, really rainy. So just some context. It's a rainy day here in Indianapolis, Indiana. I'm a pharmacist by training, and I worked at Purdue University for 15 years. I'm a clinical professor in the College of Pharmacy at Purdue. I'm not your traditional pharmacist that you think of, counting pills and whatnot. I actually work in a primary care clinic, a federally qualified health center that serves primarily 85% Spanish-speaking patients, but or people. And what I do there is I do medication management for people with diabetes, who also have problems with high blood pressure, cholesterol. They may smoke or use tobacco products. And we also do vaccinations as well. So I work right alongside the primary care providers, and that's sort of my clinician hat that I wear. And I also serve as the director of our Center for Health Equity and Innovation at Purdue. And so we do a lot of work in the communities, with the communities, for the communities, and a lot of health access improvement through food banks and homeless shelters is a lot of the work that we do. So I've been in the diabetes space for a really long time. I have pre-diabetes, but also occasionally use insulin for my postprandials, and I take metformin and I wear CGM. So I have that on to give me some credit as well. So I have a lot of perspective, both sort of from the patient. I'm a patient in a number of other arenas too, not just the pre-diabetes arena. So I have a patient perspective. I have the pharmacy perspective. I have the patient, been supporting patients with a lot of barriers, all of the barriers for a really long time. So happy to be here and happy to answer a lot of questions.
Jasmine, thank you very much. I don't know when you have time to raise children and take a breath, but you also have a volunteer life as well. I know you serve on the Diabetes Leadership Council board, but you also serve ADCES as well, correct?
Yes, I've been on the ADCES board. Now I'm on their professional practice committee. Can't remember all the other things I do, but I also I'm on a task force for CBDCE. So yeah, I do a lot with the diabetes.
Wasn't there some little Washington thing you did?
Oh, right. Yes, I served on the National Clinical Care Commission alongside some federal agencies to help improve diabetes across the nation as well.
Thank you for your hard work on that, by the way.
Of course.
Marissa, it's hard for me to ask you to introduce yourself because I know you so well and I have known you so long, but I know you are the clinical director for children with diabetes. And you probably won't say this in your introduction, but those of you that know about children with diabetes, Marissa Town is the reason children with diabetes exists. So Marissa, would you just give a quick introduction to yourself?
Yes, it is hard to introduce yourself that way, but guilty as charged. So I wear a few different hats as well. Not quite so many as Jasmine. I'm very impressed. But I am first and foremost, I am a person living with type 1 diabetes for 33 years. And then, I became a nurse and I became a CDCES after that. So what I'm doing now is I currently work for Children with Diabetes, which is a nonprofit that helps people with living with diabetes via education, support, empowerment, and connection to other people living with diabetes and their families. Started out very much as a pediatric group. Lots of kids with diabetes and their parents would come. And, we grew up, all of us with type 1, which is great. So it's really fun being a part of this shift in this organization and really providing care, connection, and empowerment for adults living with type 1 as well. I also work on Project Echo at Stanford. We are doing a Project Echo Diabetes, which helps primary care physicians learn about diabetes technologies, learn how to talk to people respectfully, how to offer choice, things like that. And I really am passionate about health equity and access as well.
Thanks, Marissa. And both of you, thanks for all you all do, because without you, people with diabetes like myself could not live as good a life as we do. Let's get right into this. So this question is for both of you. What choices should patients have in their management? Technology, medical devices, medications, treatment regimen, physician, care team. What choices should patients expect to advocate for themselves or make for themselves? And whichever one of you wants to start, go right ahead.
I'll start for the sake of efficiency. Just, we don't have to argue about it. So all the choices, Stuart, I would definitely say that every single one. And I love it when people come in and they say, I heard about this new medication. That is advocacy for yourself, right? Please talk to me about the new medication, because for whatever reason, as a clinician, I may have a lot of ideas for what might be good for somebody. And that's from my perspective, and they probably are good. They might be effective, but from your perspective, you may have heard about something and I can offer my opinion just from what I know about that medication, what I know about that treatment, whatever, why that may or may not fit or align, or maybe it just wasn't on my radar. Maybe it's something that I should be considering for you, and for whatever reason I didn't. So I think that when the person with diabetes is sitting in front of their clinician or at any sort of treatment management decision, I think that they should be advocating for themselves and thinking about, what do I, or even if it's not that you're familiar with a specific new treatment, but you might even start out with, what are the new treatments, or what should I know about, or what haven't I heard about, So I think all the treatments, Stuart.
Marissa, anything you want to add to that?
Yeah, I love it. I just put in the chat hashtag all the choices, because I completely agree. And, what I'd like to add is, I think it's not only the responsibility of us as people living with diabetes to speak up and advocate for ourselves, but everyone that's working in diabetes on the different levels of care teams to advocate that the providers give the information that they have to their patients. And, this is something where it can be challenging for some people to speak up. I'm Jasmine, as you talked about your FQHC with people that are, predominantly Spanish speaking, they may not feel as comfortable speaking up for themselves. So, and that's another reason for us as, people working in diabetes to be advocates for everyone, so that, their voices are also amplified.
Great. So let's talk for a minute about the disease. As you two know, so through your medical background and your everyday practices, diabetes is not a disease that is one size fits all. Diabetes treats every person differently. Not every type 2 or every type 1 can be treated the exact same way. So people use different therapies, different technologies. And Marissa, something you and I have talked about, off-label use. I know, Jasmine, you didn't hear that. In order to successfully manage their condition. So who should be responsible for making decisions about patient care? And from your all's perspective, why is this important? Marissa, I'll let you start.
Yeah, well, I think you said it very well. It's not a one size fits all. And I sort of joke that it's not black and white. It's entirely gray area. Like, there is no like A plus B equals C. It's like A times B might equal C today, and tomorrow it won't. It's just, I when I was a kid, I used to think of it like a game, and like a game I was trying to win, right? But always inevitably fail. Like you win some days and you celebrate them. But that's the whole point, you know, if this is so difficult and challenging for people to meet goals and achieve goals, and as we know, most people in the United States and across the world are not meeting the targets that reduce risk of complications, right? And that means that they're also not having good quality of life. So if we know that it's this hard, to the point that we have a whole specialist group called clinical diabetes care and education specialists, like the fact that my job even exists should tell you how difficult this is to manage and how highly individualized it is. So if you're not letting people make decisions for themselves and their own care, I don't know how you expect them to maintain resilience, because this isn't, this is a marathon, not a sprint, right? This is for the foreseeable future. You have to manage your diabetes, right? And so we need to make sure that we're giving people as much autonomy, as much choice as we can to just help them not even succeed, but just be able to keep going from day to day, being like a productive, normal human, member of society.
Yeah,
Yes.
and the only thing I'll add to that, Stuart, really is just, I think a piece of what you asked was who should be making the decisions on the treatment. And I can tell you who it should not be. It should not be the insurance companies dictating which treatments are most appropriate or most comfortable for people. And we know that that's a huge problem with the structure of how things happen now, that insurance can dictate, well, we want you on this one and this one's approved and we don't want you on that one. You haven't tried this one, so you got to try this one first. So I think that's obviously something that we work on with the Diabetes Leadership Council, and a lot of people advocate for, or against, I should say, but that's a complexity that is just sort of a reality of what people with diabetes struggle with, is not being able to choose freely which treatment is most appropriate for them, even if that's what they want and that's what they need, that they don't get that choice based off of insurance preferences. So that's something that I think we're all very well aware of, but that exists and is a part of this conversation.
So if I made the statement that insurance companies and their devil's handmaiden, the PBMs, the pharmacy benefit managers, have no duty of care and are not medical professionals, would you agree with that statement?
That we have non-medical professionals who are making these decisions? Yeah, absolutely. Every day. And I get feisty on the phone with some of these people. And it seems sometimes, and I'm sure there are a lot of people who have navigated this and are just as frustrated, if not more, that it doesn't make sense. Why is it so hard? And sometimes it feels that it's hard on purpose so that the bottom line is the bottom line for somebody. And it has to go, and it has to deal with people making profit. That's what it feels like. I don't want to, kind of amplify a toxic narrative, but it does feel like that sometimes. That why is this so difficult to navigate? And why does it feel like we're not supported in doing what's best for people with diabetes sometimes?
Okay, so Marissa, if you could, for me, briefly address what you've seen in your experience across the different sectors that you work with, working in clinical diabetes care currently or up till now, what's been done successfully to help people make those own decisions that they need to make in conjunction with their medical team?
Yeah, I mean, I think it's unfortunate because I've seen, across the spectrum, right? I've seen things that have gone really well to things that have just not gone well. I met a woman who had been on a pump for 40 years or something and had diabetes for 40 years, been on a pump for so long, only wearing it in her abdomen, and had incredible scar tissue because of it. And, it's just things that without access to providers that are educated, it's hard. But even when you have a provider that's educated, they're fighting against your insurance, and this is something that we all agree on, both patient and providers, is we shouldn't have to be writing these letters, making these phone calls, because that's what ends up happening is sometimes they have to make these hour-long phone calls, these physicians, right, to get their patient a CGM or a pump. It has gotten better, I think, over the last few years. I think having, CGMs covered better by Medicaid, I know Medicare's, slowly getting there. I think it's gotten better, but I think it's taken the work of DPAC, the work of diabetes advocacy organizations, the work of the big groups like ADA saying, you guys can't keep doing this. We need to actually help our patients. But I think we have a long way to go. And until the companies are, basically forced to choose people over profit, I'm not sure how we'll get there without continuing to raise hell, basically.
So don't forget Children with Diabetes and Friends for Life that gives a platform for people like myself to help patients and what they're doing. I know you can't forget that, but let me throw that in there. And before we get off the call, Marissa, I'm going to ask you to address that. Jasmine, so from your medical and pharmaceutical standpoint, same kind of question, what's working, what's not working? How can people successfully navigate this system?
What's working is we have seen amazing advances for diabetes recently. And obviously there's still room for growth and there's still room for discovery. But what is working is that we are seeing nuanced advances in diabetes, both in the type 1 and the type 2 space and beyond type 1, type 2 space. So I do think that that's working. I think we are also seeing momentum, with most recently seeing some advancements in insulin affordability, seeing that. I think, even if some things we can define, I think it's subjective as a small win, but they're wins, and we are winning on some fronts. And I know locally here in Indiana, where Medicaid is paying for CGMs without requiring insulin. So these wins are happening, and I feel like they're happening more quickly, even though they're happening slowly. I still think they're happening more quickly than what I've seen in the past. So I think that those are wins that we can celebrate on, and also help propel and continue our momentum in these spaces, and especially in the advocacy spaces where we can still make improvements. I think that those are wins, and where there's still areas for improvement is in the same area, in the same advocacy space and in the same affordability space. And particularly, as I mentioned, was in the insurance coverage. I think that we've seen gains, and there's still a lot of room for improvement. It's a whole spectrum, but it's all the same space. I think insurance and advocacy, really.
So Jasmine, let's stay with you for just a second. And you brought this up. What can patients do to advocate for themselves? Say if their claim is denied from their insurance company.
I wish I had a better answer than keep on fighting and keep on advocating and know the appeal process, and it's so frustrating, right? And sometimes you feel like you're kicking and screaming and nothing's happening and nobody's helping. But sometimes you do hang up on the rude person, you call back, and maybe you actually get a helpful person. And that is not, expert advice that I have, but I have seen it happen where when you do keep fighting against whatever, a claim wasn't approved and that it's supposed to be approved, or you just need one piece of evidence from your provider that something is justified and could be paid for, that there is there's a lot of resilience in that process. And if you stick with it, that you will have wins, you will also have losses. But I think trying and educating yourself and documentation in that process of, this is what I tried, this is who I spoke to, you said you were going to follow up at this time. And gosh, that takes resilience and persistence, but you can win sometimes.
Marissa, same question.
I was just going to add to that. There's a couple of things. One is, have people in your corner to help you. Like, when I was pregnant, for example, I asked my husband to do all the insurance calls because I didn't want to get too upset while I was pregnant. Sometimes you just need someone in your corner to fight that fight for you. And, the other thing is, you can try to find a provider that will work hard for you. Find someone that is willing to go the extra mile and really work to get you what you want. And then the other piece to this is there's a website that is based out of Stanford that's non-biased about diabetes technology. And they have a whole section that helps providers fill out the paperwork, because you know how it is, right? Like, you got to fill out all these forms and figure it out and how to get things approved. And it has advice on how to get things approved or what is required to get it approved. So if you check out diabeteswise.org and have your provider look at, you could even print out the form, take it to your provider and say, hey, this is what I need. And sometimes people will do that.
And Marissa, we forgot to mention asking for a diabetes care and education specialist.
Yes. Oh my gosh.
Right. Whoops. So asking your clinic, your endocrinologist, your primary care provider, is there a diabetes care and education specialist that is accessible to you? Because those are going to be the people who know the ins and outs most of the times of navigating barriers and knowing that landscape to be able to sometimes provide access in different ways that may differ from your physician or from your endocrinologist.
Yeah, and you can actually use the ADCES website to find a diabetes educator near you. You can search for educators on there.
And, in Kentucky and Indiana, they're licensed. So that's the only two states that actually license diabetes educators right now. So, and if there are questions from the audience, please put them in the chat and we'll try to answer them here in just a few minutes. So have either one of you, actually I know the answer to this question, but I'm asking it anyway. Have you either one of you testified or reached out to your legislators about diabetes bills or anything that needs to happen on a state or a federal? And was that easy for you or was it hard?
Yeah, I guess I'll start first. So I think, signing up for, DPAC's updates, I believe it's called a DPAC champion, but I get emails or updates and I follow things on Facebook, of course, and social media, but they make it so easy now to reach out to your state legislators. It's honestly incredible. And I really do think it makes a difference. I think, there has been so much in the media in the last couple of years about insulin affordability, and everybody raised their voice and said, yes, like this is something that needs to happen. And like Jasmine said, we really are making progress there.
Yeah. And yes, to everything Marissa said is that it's kind of a spectrum and of advocacy, right? You can click on a DPAC, sign this petition, and then you're done. It takes a few seconds. And then there is being in the state house, testifying on behalf of a diabetes bill that is obviously a little bit more complex and takes your time, and and then there's in between, setting up a phone call with your local legislator to talk to them about diabetes and to talk to them about your experience and difficulties accessing whatever it may be. So it can be as difficult or complex as how and or easy as you can make it. But I know DPAC is a fantastic resource to sort of help you navigate that spectrum of where you want to be on that spectrum of, I want to click a button and send a letter versus I want to go testify on behalf of local bills or federal bills or so I think DPAC is a fantastic resource, and it's much easier now than it has been in the past with organizations like DPAC.
So as we close this out, I think what I've heard today is that PBMs and insurance companies are not medical professionals and should not be making choices for patients. And patients need to be the squeaky wheel when something happens. But I'm going to say something that both of you I know will agree with me and probably echo. Never, ever, 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 ever ration your insulin. Ever. There are ways to get it, either through your medical professionals or through other opportunities. Lilly's announcement on the $35 that they came out with, Novo and Sanofi both have programs that you can get insulin. Almost all states now have got the law that gets emergency insulin if you have to have it and your doctor's office is closed. Don't ration insulin. It is not the smart thing to do. And I'm assuming both of you would agree with that statement.
Absolutely. And you can always go get the over-the-counter without a prescription insulin at Walmart. It's maybe not quite the same, so you should talk to somebody or look up online how to dose it. But, you know, in a pinch, it's going to keep you alive.
Anything, Jasmine or Marissa, that you'd like to close out with?
I think we covered it. I think you asked some good questions, Stuart, and I don't know that I saw any specific ones in the chat that we need to address, but I don't know if I kept up with it.
I don't think there is. Marissa, do me a favor as you close out. Give me a 30-second elevator speech on FFL.
Yeah, so Friends for Life is, you know, basically what I mentioned about, you know, building your team of support network for people with diabetes. It is the largest event for people living with type 1 diabetes that exists. It's a gathering of people in Orlando every summer. You know, the best time to be there is July, obviously, in Disney World, with people that, you know, like Jasmine, like people that are passionate about diabetes, that work in diabetes, that are doing research, that not just about the technology, but about diabetes distress, burnout, how to prevent it, things like that. They come down and talk to families and people living with diabetes like me and my parents. And it's hard to describe, but it is definitely the embodiment of education, empowerment, and support. And, you know, if you need help advocating for yourself in your hometown, just talk to some of these other moms or people who have done this a few times, and we're in your corner. So.
Thank you, Marissa, and thank you for I'm full disclosure, I serve on Marissa's board. I serve on the CWD board, but it is a life-changing experience for everyone, not just the person with diabetes, but the family as well. So, Marissa, thank you for everything you do. Jasmine, as always, thank you for taking time out of your busy schedule. We appreciate it. And folks, be a squeaky wheel. Learn your skills. Jacob, you're welcome to come back on and close us out and talk about the breakout sessions. But the two things that the getinsulin.org, that's what I was trying to think of, Marissa. Getinsulin.org is the website that has all things insulin about it, that can help you when you need help. So, Jacob, I'm going to turn it back over to you. Thank you all very much for being here. And once again, Jasmine and Marissa, thanks for making me look so good. I appreciate it. It's always easy when I've got great people to ask questions to. So thanks again for all you do.
Thanks for having us and for what you do.